Vagal inhibition or vasovagal shock reflex cardiac arrest, also known as nervous apoplexy or instantaneous physiological death. Instantaneous physiological death means death of a person with a no abnormality sufficient to presumed to have caused death, where death occurs within few seconds, sudden death occurring within second or minute, or due to minor trauma or relatively simple or harmless peripheral stimulation caused by the vagal inhibition mechanism. The pressure on the baroreceptors situated in the carotid sinus is a carotid sheath or carotid body located in the dilated part of the wall of the internal carotid artery, just above the bifurcation of the common carotid artery, situated above the level of the mandible and the upper border of the thyroid cartilage, causes an increase in the pressure. Increase in blood pressure in sinuses with the resulting slowation of the heart rate is low. Dilatation of blood vessel causing fall in BP. Carotid sinus stimulations contains numerous nerve endings from the glossopharyngeal nerve. It communicates with the medullary cardiovascular center in the brain and the dorsal motor nucleus of the vagus. It is intimately connected with the control of BP and heart rate. In normal persons, pressure on the carotid sinuses causes minimal effect with a decrease in heart rate. The decrease in heart rate less than 6 beats per minute and only a slight reduction less than 10 mmHg blood pressure. Some individuals show marked hypersensitivity to stimulation of the carotid sinuses, characterized by bradycardia, ventricular arrhythmia to cardiac arrest. Stimulation of the carotid sinuses baroreceptor causes impulse to pass via the hearing nerve to the afferent fibers of the glossopharyngeal nerve, ninth nerve. Thus in turn link in the brainstem of the nucleus of the vagus nerve, 10th cranial nerve. Parasympathetic efferent impulses then pass to the heart via the cardiac branches of vagus nerve. Stimulation of these fibers causes a profound bradycardia. This reflexes arc is independent of the motor or sensory nerve pathways. There is wide network of sensory nerves in the skin, pharynx, glottis, in the body, skin, pharynx, glottis, peritoneum covering viscera, resting into spermatic cord, cervix, everywhere, urethra, brain. Okay. After afferent fibers from these tissues passes into lateral tracts of the spinal cord. Afferent local reflex connection over several fragments also pass to the brain. The vagal nucleus is controlled by the synaptic connection in the spinal cord, which may be facilitated from both the sensory central cortex and from the thalamic center. Later may be responsible emotional tone noted in the vagal reflex. The parasympathetic stimulation of the heart can be initiated by high neck compressions, pressure on carotid sinus, or sometimes direct pressure over the trunk of the vagus nerve. The commonest cause of such inhibition is pressure on the neck, particularly on the carotid sinuses, as in hanging or strangulation. Sometimes impaction of the food in the upper respiratory tract, sudden immersion in cold water, unexpected blowers of the larynx, chest, abdomen, extensive injury to the spine or parts of the body, insertion of an instrument in the bronchi, sudden evacuation of pathological fluid, sudden distension of hollow muscular organs during attempt at this criminal abortion, or any degenerative diseases of the heart. There is a great variation in the individual susceptibility. Death from inhibition is an accident and caused by micro trauma. The stimulus may be sudden and abnormal for the reflex to occur. The reflex is exaggerated by fear, apprehension, struggling. Autopsy when death occurs a result from inhibition. There are no characterized post-mortem appearances also. This is vagal inhibition. Thank you.